Welcome back. I'm Brent Meredith, and if you're just joining us, I'm talking with Selena Haynes, Connect Media Group co-founder, and Ray Zimmerman, director of the Office for Diversity Affairs and LGBTQ Health at Vanderbilt University Medical Center, about their upcoming Community Health Fair on Saturday, April 30th. So, Selena, I mentioned before the break I wanted to circle back to you. When you were setting this up and reaching out to vendors and sponsors and sort of looking for, any part of an event, as we both know takes a lot of effort, did you hear any pushback? Was there anything negative? Oftentimes, folks may not want to work with our community, or you pick up a snide comment or review. How are things in the world now? Is that still happening?
At this point, we haven't had any pushback whatsoever. If there have been some people who didn't want to participate, we may have just not heard back from them, which I appreciate that. Just, you don't have to respond.
Yeah.
I can take your non-response as a no. So.
Well, and I'm encouraged to hear that. It is nice to know that, I remember years ago we were doing endorsements with Out and About Nashville for different local races, and we had people accuse us of endorsing people deliberately to hurt their campaign, right? Like, so we hate ourselves so much that we're going to thrust our stigma on you to make you lose. So it's just nice to know over time that people genuinely want to be a part of our community or service our community. So, soapbox sermon over. So Ray, you work with many different offices there at VUMC and other healthcare providers. What do you think that they might need to take away from this as either an exhibitor, a vendor, or even just someone maybe as an attendee?
Sure. Well, I think one benefit of this event is for all of our community partners to come together. I think over time, it's going to be really important to build a healthcare coalition. What I know is that Vanderbilt cannot be a resource for everyone. I would love it if we can, and hopefully we'll continue to push that envelope, but we rely on our community partners. And so I'm always looking to expand our network to be able to refer patients to other places. We actually rely on a lot of community-based mental health professionals to meet the demand for mental health concerns within our community, for example. And so I think we all should be playing in the same sandbox, and this is a great opportunity. And I just really applaud Selena for putting this fantastic event together. I think this will be a crown jewel in programming for our community, and I hope to see this established and grow in years to come.
So Selena, somewhat of the same question for you. I'm curious because, we had mentioned referrals, and as you said, you hear from folks that maybe move here because of the publication, asking for help finding a provider and whatnot. What do you tell them, and what do you hope that those people that you're referring out are going to take away from this? In other words, what do you think they need to, sort of gather at this event? What is your selling point to, I guess, even get them to be there?
Great question. Yeah, with the referrals, of course, anybody that I know, I always personally can refer to people who are asking. But, come to the event, meet the providers who are there. We have everything from mental health to primary care to organizations like Vanderbilt that have a network of people for you. We even have a dermatology clinic coming. We have somebody who does Botox. So we have a variety of different services that people will be able to have access to. So it'll take some of those steps out of trying to find somebody.
And that's exactly that's wonderful. That's exactly what we want. And it provides a little of a space where then within those networks people can communicate and talk to one another. It's a fantastic way for people to find those folks and sort of that firsthand recommendation that they're looking for when they reach out to the editor of the paper, for something. We're nearing the end here, so I want to make sure we get the nitpicky details. So tell us the who, what, when, and where, Selena. Where is the event? What time? How do we get in? Are there COVID protocols?
Absolutely. Well, our venue sponsor is actually Southwestern Travel Center. They're located at 2451 Atrium Way, which is the road that runs parallel to the chapel, right off of Briley. I think a lot of people are familiar with that. There's no charge for parking. There's ample parking there, and we also have made sure that there's abilities for anybody who have any AD type of disabilities to have access to the building as well. And it'll be taking place on April 30th from 10 to 4. We encourage you to wear a mask. We encourage you to be vaccinated. We're not going to require it at this time unless something changes within the guidelines with CDC or local or state laws. So
fair enough. And I think you've got a specific URL for the event too, where folks can go get more info, right? What is that?
Yes, it is healthfair.weconnect.lgbt.
One more time, if you don't mind.
Sure. Yeah. healthfair.weconnect.lgbt.
Which the .lgbt, I'm glad you mentioned that. I thought it was a great, it's a great domain or thing. So, and I think that's the part of the domain of Connect as well, right?
Yes, our main website is weconnect.lgbt, and that's exactly what we try to do with our brand, connect people. So.
Cool. We've only got about 30 seconds left. Del Rey, I just wanted to kind of end with you. Are you going to get to be at the event personally? And how is y'all's booth going to be set up? And what can people sort of expect to come and ask?
Sure. Well, yes, I will be there personally, and super excited to find out about the Botox provider. I'll definitely be at that booth for sure. But we'll be distributing information about our clinical services. Folks can certainly come ask us a whole host of stuff. We also can help provide, again, those.
I hate to interrupt you, but we're out of time. The time always flies. We never have enough, you guys. Thank you so much for being here. And that's all we have for tonight. We'll see you next.